So as I mentioned earlier, my guest today is Dr. Jocelyn Strand, but she couldn't be on here live because she had a sudden conflict of time, but she did do us something really solid, and she pre-recorded an interview just for us. So we were already planning to do a slide presentation, so she just is going to go ahead and do her slide presentation. So a little bit about her. Dr. Jocelyn Strand is the Director of Clinical Education at Biofilms. Dr. Jocelyn possesses a reverence for botanicals, a passion for science, and a vision for increasing awareness about naturopathic medicine. In her role with Biofilms, she monitors and participates in research, trains clinicians, and is a respected and engaging speaker. Before joining the company in 2019, Dr. Jocelyn was a primary care provider specializing in GI system disorders, Lyme disease, and autoimmune conditions. She graduated from Bastyr University in Washington in 2005 with a doctorate in naturopathic medicine. Dr. Jocelyn lives on 10 acres in Minnesota with her husband and 2 sons, where they are trying their hand at making maple syrup and beekeeping. Super cute. So I put on Facebook, but I'll put all the notes here on the webinar as well, just to kind of celebrate this topic. For about a week, we are doing a sale on all Biofilms products. That includes their GI detox binder, which is super important and popular, their toothpaste, which is one of our top sellers, the mouthwash, and then some of the botanicals we'll talk about today. Since we're talking about the gut today, and a great way to get a more focused protocol going for your gut is to test, we're also doing $50 off the GI map. GI map is our preferred PCR stool test, looks for RNA of certain pathogens, among other things. So I wanted to do a quick unboxing. Actually, right away, you'll get instructions from us so that you know how to use the kit, and and how we kind of recommend it, what to get off of before you take your test. Has this awesome like French fry tray to poop into, and then you scoop out some poop. There's gloves I think in here and a scooper, and then you put it in this little bottle that's inside, and then you just mail it back with FedEx. So I didn't pull out an example of the report, but the exciting part comes when you get back your test results. And it's a great test for kind of markers of leaky gut, dysbiosis, which is an imbalance in the bacterial population of your gut, certain pathogens like candida, although this isn't the best way to test for candida. Sometimes it will show up, some parasites and worms, about 10 of them. What else? Some markers if maybe there's some improper detox happening in your gut, and certain like acute infections could show up on there as well that have become chronic in people, like Giardia or something. So it's a super interesting test. It's been my favorite. I've had no desire to switch away from it. We're really happy with it. So you're welcome to ask any questions about that on the chat. And let me load up the presentation with Dr. Jocelyn. Let's see here. Okay, so I think this will work. Here we go. Let me know in the chat if you can't hear it or anything, but you should be able to hear it.
Hi, my name is Jocelyn Strand. I'm a naturopathic doctor in northern Minnesota and the director of clinical education for biobotanical research, the makers of Biocidin. And I'm here to talk to you today about dysbiosis and its role in toxicity. So we'll talk some about what is dysbiosis and how we typically think about toxicity and the ways that we can support detoxification by managing what's growing on our body in terms of bacteria and fungal elements and viruses, all of that. And we want to say a big thank you to Bridget Danner for having us on the show today. And I hope that we can bring you some information that helps to empower you in your own life to take control of of your own health and to find balance in that way. Before I get started, I am a clinician, and so you'll hear me talking some about my clinical experience using a product. I'd like to make sure that you understand that that is not a claim by the company. We do have some published research, and where that's relevant, I'll make sure and state that. But when you hear me talking about my clinical experience, it's purely my observation as a clinician and not a claim by the company. So let's first set this stage. This is kind of how I think about, in general, about toxicity. I think there are a lot of companies out there, a lot of products out there that are talking about detoxification, and they all include nutrients like, say, milk thistle or N-acetylcysteine or glutathione, and these are all important nutrients for detoxification. And I think when we think about toxicity, we often associate that with air pollution or water pollution or toxins in our food or exposure to plastics and other chemicals in that way. What we don't always think about is that or often don't think about, right, is that toxins are generated also in our own body. So an easy way to think about that is inflammation. Inflammation, we need to have some inflammation because that's what helps our tissue heal. Like if we get an injury, then that inflammation will really help our tissue heal. But if we get too much inflammation, then our body has to clean that up, and it's actually a source of toxicity in our body that our body has to manage, has to metabolize, has to clear in order to function appropriately. So we also have, more actual cells of microorganisms in our gut, on our skin, all over our body, but primarily the reservoir is in the gastrointestinal tract. And those microorganisms require balance. So if our microorganisms get out of balance and we get that's called dysbiosis, right? So if we get an overgrowth of gram-negative bacteria, they'll produce metabolites as part of their life cycle. They produce metabolites that are very inflammatory and very toxic to our body. And this is called endogenous or internally produced toxicity. And that's important because if you miss it, you will have a chronic and ongoing source of toxicity that's being produced right inside your gastrointestinal tract or on your body. So it's really important to evaluate this. As a clinician, it was important for me, and it was an accidental finding for me, actually. When I started adding in a microbial detoxification or balancing as part of my detoxification protocols, I watched people take their detoxification to the next level, and I saw lasting therapeutic effect. And so that's why I got into this and how I think about dysbiosis, and one of the many reasons why it's very important to manage the balance of microbial growth in the body. So let's talk a little bit about a healthy microbiome first and all of the ways that it interacts with us. So the first one is production of SCFAs. Well, what are SCFAs? So short chain fatty acids is what that stands for. And the important part to know here is that short chain fatty acids are a chemical component or a molecule that are produced by microorganisms in the lining of the gut. Once they're produced, they cross, first of all, they will feed the cells that line the gut and help with healing in that way. But they also cross into the bloodstream, and they are an anti-inflammatory, which means that they can reduce systemic inflammation in the full body, right? So that means joints, it means brain, it means heart or cardiovascular system. So these short chain fatty acids, we know that they reduce risk of autoimmune disease, they reduce generalized inflammation. And so a really important piece to identify as a role for beneficial microorganisms in the gastrointestinal tract. So in addition to that, a healthy microbiome also helps us with hydration. We know how important that is, especially for detoxification. Nutrient synthesis, which I think is so amazing, fascinating, right, is that CoQ10, B12, and multiple vitamin K. There are multiple nutrients that are produced by the microorganisms in the gut. So when we have a healthy, robust community there, we can have better nutrient status as well. Control of epithelial cell proliferation, protection against pathogens by a barrier effect, so that if you do end up getting an exposure through food poisoning, through inhalation, you're out and about and you inhale some, whatever you get exposure to. Then immune reserves for systemic defenses. This is a really important piece as well. Up to 85% of our immune system is in the lining of the gastrointestinal tract. Our immune system is what mediates, of course, keeps us healthy, right? When we get an exposure to a microorganism in the outside world, but the immune system is also responsible for tissue repair. It's responsible for inflammation levels. There's so much that our immune system is responsible for. And when we have healthy microorganisms, it interacts appropriately in the gastrointestinal tract, and it helps to establish healthy boundaries between the outside world. So we get tolerant to things like foods so that we are less reactive to foods. And it also makes it so that we can respond in the event of an infection, that we can respond effectively and get on top of an infection. It also can help establish a healthy immune response in terms of not being hyperimmune or autoimmune tendencies. So there are so many ways where having a healthy microbial balance in the gastrointestinal tract really supports our systemic health. All of these are really important where detoxification is related, because almost one and the same are toxicity and inflammation. Inflammation is a very toxic event in the body when it gets out of hand. So when you hear me talking about inflammation, for the purposes of this conversation, it's very closely related to our toxic load, which means all of the different toxins that we have exposure to and that our livers and our bodies are managing at one point in time. So short chain fatty acids, we just talked briefly about that. And you can see that here on the diagram. Let me get my little tool, my laser pointer going here. So here you can see short chain fatty acids, right? So these, again, the short chain fatty acids primarily that we think about are butyrate, acetate, propionate, and those, again, are systemic anti-inflammatories. They're molecules that are produced by microorganisms, healthy or beneficial microorganisms in the gastrointestinal tract. And there are a couple of ways we can get them to produce more, those microorganisms to produce more short chain fatty acids. The first is by feeding them, right? So we give them the fodder that they need to produce it. And those are things that contain butyric acid, or they're non-soluble fibers. And the microorganisms will use those to produce the short chain fatty acids. They also need enzymes in order to do that. And there are botanical medicines or herbal medicines that help stimulate the production of those enzymes. And so there are a number of different ways that we can support the production of short chain fatty acids. So just a piece of awareness, I think it's really easy to get sidetracked and think, oh, that's a prebiotic is how we talk about it in the medical industry and the alternative medical industry and nutrition industry, right? Is that we think of a prebiotic as something that's food for a microorganism to produce more beneficial microorganisms or to produce more of these beneficial metabolites. But there also is this other piece, right, which is a prebiotic, is anything that promotes the health of an organism, and the botanicals can also do that in a different way, right, by helping them to produce the enzymes instead. So really interesting, and that was kind of news to me recently to think about it. It was a little bit of a mind bender for me. So I'm going to try not to linger here too fast, but I think this is really fascinating, and it will speak a little bit to what we talked about with immune system function and the microbiome. So a successful response in our bodies is a result of an anti-inflammatory element and a pro-inflammatory element, right? So we need some inflammation. We don't want too much, right? So we want to, again, find balance. So balance is the key, right? We don't want to wipe anything out. We don't want to ramp anything up. That's true for the microorganisms. That's true for inflammation. And so just remembering to hold balance, and how do we maintain balance? And so let's talk a little bit about the cascade of events that happens in terms of immune system function and the role of the microbiome in the gastrointestinal tract. So let's pick a virus, for example. If we get exposure to a virus and it starts to replicate, starts to reproduce in our sinuses, and we start to make, as a defense, we start to make mucus, and some of that gets post-nasal drip, and you'll see the virus sort of bumping along in the gastrointestinal tract. I think this is so fascinating, but right here you can see this dendritic cell. A dendritic cell is part of our immune system. Our immune system takes a different form in all different tissues of the body. And here you can see that this dendritic cell is sampling microorganisms and whether it's a bacteria or a virus or a toxin, the dendritic cells are sampling it, pulls it inside inside the bloodstream, or actually into the lymphatics, and the lymphatics are part of our immune system, where it samples it, and it produces a whole artillery against that. And then it sits there and waits, right? So it doesn't get into this, that artillery doesn't get into the systemic circulation unless we get an infection. And if we get an infection, then the artillery is ready, and it will go to that site. So say it happens in the lungs, like we start to get bronchitis from a virus. Then we have that artillery. If we have a healthy gut, the microorganisms that are here in the gut supporting the health of the outer mucus layer, the inner mucus layer, all of this mucosa is called, and the cells lining the gastrointestinal tract, and keeping all of this healthy, we will be more likely to have a healthy immune response. We will also be more likely to be able to clear toxins effectively. You can see IgA here. IgA is an antibody. So this is produced by our immune cells, and it exists here in the lining of the gut, the mouth, the sinuses, the ears, the eyes, the genitourinary tract. We produce IgA on every surface of our body, and the gut is considered a surface of the body because the outside world is touching it there. It's kind of how I would think about it. But one of its jobs is to identify and bind toxins. So when you're talking about detoxification, say a glyphosate molecule is floating down it, or a petrochemical, the IgA might bind it. It basically makes it inert, so it doesn't harm us. And it also binds it so it moves out in the stool so that we don't absorb it, where it can cause irritation and where our liver then has to manage it. So there are all of these ways in which it's really important for us to maintain a healthy microbiome and healthy gut integrity. What can happen also here is that you'll see if there's dysbiosis here and inflammation here, then we'll get an increase in the production of something called LPS, or lipopolysaccharides. So that is something produced by gram-negative bacteria. It's pro-inflammatory. Damage then from the inflammation can happen to the lining of the gut and damage the mucosa here, and then to these tight junctions, which you can see here, these little red things. And that's basically like a fence. I would think about it like a fence. And when you damage it, then you have toxins and microorganisms and other debris crossing directly into the bloodstream, which flows right along next to this. There's only a single layer between the gastrointestinal lining and the bloodstream. And so you can imagine the importance here of maintaining a healthy lining of the gastrointestinal tract, and we'll talk a little bit more about that as well. The rest of the slides are going to be faster, I promise. That was kind of a long one. So I mentioned LPS, which is lipopolysaccharide. It is produced by gram-negative bacteria in the lining of the gastrointestinal tract, and it is one of the chief causes of inflammation. Even small changes in LPS will increase our risk of cardiovascular disease by a dramatic amount. And it's so toxic that an injection, so in the gut, when we have LPS produced in a healthy gut, two things. One, if your gut lining is intact, most of it will move out through the stool. The second thing is all of the blood circulation around the gastrointestinal tract goes first to the liver. The liver prioritizes the clearance of LPS because LPS is so toxic that even injection of nanograms will cause symptoms of septic shock. In fact, it is responsible for septic shock, and it's so highly inflammatory and toxic, it's actually used in research to produce damage to the liver. So this is how important it is, right? In terms of detoxification, if you neglect lipopolysaccharides, you will be missing a part of the picture. So really important piece, right? In addition to that, the endotoxin and chronic inflammation, we have, it can contribute to a variety of diseases. Including autoimmunity and inflammation. It also, when it gets into the bloodstream, it circulates through the bloodstream and it can damage what's called the blood-brain barrier. And that's another single-celled lining between the bloodstream and the brain. If that gets damaged, then the blood-brain barrier is meant to keep out anything out of the brain that could damage the brain and the cells inside the brain. If that gets damaged by LPS, then we see an increase in risk of any kind of neurological condition, such as Alzheimer's disease and dementia, other dementias. And we think of multiple sclerosis or mood disorders or any kind of mental health disorders, depression, anxiety, all of those things have a potential relationship to lipopolysaccharides being released in the gastrointestinal tract or other inflammatory mediators from other microorganisms. And so every patient that came into my office that had anxiety or depression or any kind of mental health disorder, the first thing that we did was change diet and address dysbiosis, because it is so often the root cause or the underlying cause of neurological conditions and mental health disorders that, to me, it was the first thing that I ruled out and the first thing that I worked with on my patients, or worked on with my patients. I hope I said it right the first time. So let's talk a little bit about LPS and the liver, a little bit more. So we already talked about how when lipopolysaccharides do get into the bloodstream that's surrounding the gastrointestinal tract, it goes to the liver. There are a number of different kinds of cells in the liver. The one that we know about the most is actually called a hepatocyte. That means it's a liver cell. But there are also immune cells in the liver, and those immune cells receive and neutralize lipopolysaccharides, and it causes damage to those immune cells. So they're doing their job. They're working on trying to alleviate and clear, and then the hepatocytes work on detoxification from from what's in the gut, but also the entire systemic circulation. What happens when you have too much LPS is that it causes collateral damage to the hepatocytes. So the immune cells in the liver end up capturing, neutralizing, and doing their work, right, in the liver, but the hepatocytes or the other liver cells that are surrounding those immune system cells then are damaged, and they can't actively participate as well in detoxification. Now, we know this is important because, and that LPS or lipopolysaccharides, again, metabolite is produced by gram-negative bacteria in the gastrointestinal tract, but that there are animal studies that show that LPS is cleared within just minutes following an ejection, and that most of that is cleared by the liver. So liver is the main place that we manage LPS. And there are two different animal studies, really fascinating to me, that if you, how does this go? So I have to try to make sure I say this correctly. So in mice, in a mouse study, the effective LPS augmented, which means it made worse, injury by hepatotoxins. So in a mouse that didn't have gram-negative bacteria or any bacteria actually growing in the gastrointestinal tract, that if they were exposed to things that were toxic to the liver, they would they wouldn't have any effect until they added also the LPS. So really, really important finding. There was also a rat study, and in the alcoholic, rats that were fed alcohol, so basically forced alcoholism in rats, they got something called fatty liver disease, which obviously not pleasant, but not terribly dangerous, right? It alters metabolism. But when you added in LPS, then they actually had death of the liver cells. And so really significant difference when you add in the LPS. And, I'm a naturopathic doctor. I love research. I'm a scientist. And so you're going to see here research that I've pulled off of the internet and that I use to present to other practitioners. So this is high level knowledge, and I'm trying to make it as understandable as possible, but please understand that I'm presenting to other practitioners, and I'm a real geek about this stuff. So hopefully if you're still here, hang on, we're going to get to some lighter stuff real soon after we get through this science piece here. So LPS metabolism in the liver, again, adding to the total toxic load. So if you can think about it in this way, if you have toxins coming from air pollution, you have it coming from your food, you have it coming from water, you have it coming from petrochemicals or phthalates in the air when you walk through a store. You also have all of these different sort of chunks of toxicity that you can work to alter and to manage so that you reduce the total toxic load. We can do the same thing when we alter what's growing in our gastrointestinal tract by addressing dysbiosis. So this is just a picture for you to see of how toxic lipopolysaccharides are. So here's before, and what this is it's called histology, right? It's a slide of what it looks like inside a liver. They slice it very thin so you can see the individual cells. Here's the nucleus of the cell. And here you can see in a healthy liver that the cells are organized, the tissue is organized. And after exposure to lipopolysaccharides, there's basically total breakdown of the tissue, of the hepatic tissue. So very dramatic. And again, used routinely to produce liver damage when they're working on doing on research that requires damage to the liver. So just a quick thought, one additional thought here is that in addition to bacteria, gram-negative bacteria, we also have the mycobiome. And
sorry guys.
that myco means fungal. And so we're talking here about fungus and its ability to produce inflammatory mediators as well. So not to be forgotten or not to be missed is that we have the gram-negative bacteria. We also have our fungal or microbiome that needs to be maintained as well. And it's really common for people to have fungal elements in their gastrointestinal tract. The one people know the most is Candida albicans. Most people stumble of Candida. But if it gets out of balance, and that can happen from antibiotic use, it can happen from overconsumption of carbohydrates, it can happen from the use of NSAIDs, it can happen from stress. And so just think if we can imagine the importance, again, of finding balance in all of those things. And this is just an illustration. This is all inflammation here that's produced in this case by Candida albicans. Aspergillus is another fungal element. And you can see here that all of these inflammatory mediators will be produced over time, having to be managed by the liver and affecting our toxic load. So SIBO and liver disease, and this is just to bring this back, the importance. SIBO is small intestinal bacterial overgrowth. So it's basically an overgrowth of bacteria in the small intestine. Most of those are going to be gram-negative bacteria. And you can see that here it's related to liver disease. And again, small intestinal bacterial overgrowth associated with non-alcoholic fatty liver disease, but also a finding in this research of the relationship between overgrowth in the small intestine of bacteria and also intestinal permeability. So again, the loss of the integrity of the lining of the gut resulting in the movement of metabolites, toxins from the gastrointestinal tract into the bloodstream that the liver then has to manage. So this is an interesting concept to me, is this gut-liver axis. So part of it, I would think about this as a feed-forward cycle, and I talk a lot to my patients about the release of the importance of having good stomach acid. When you have good stomach acid, that stomach acid helps stimulate the release of bile and pancreatic enzymes. That bile is full of bile acids, and those bile acids are antimicrobial. That means that it keeps the small intestinal bacteria in check. That's the first thing it does. And it also helps to emulsify our nutrients and move them across into the bloodstream so that we have good nutrient status. If we have dysbiosis in the gastrointestinal tract, those bile acids actually, some of them contain toxins. That's a lot of what's in the gallbladder, right, is our toxins being released into the small intestine for movement out of the gastrointestinal tract through stool. And if we have dysbiosis, those bile acids will be altered into something even more toxic than what is released, right? And so this is secondary bile acids, and it's the metabolism of those bile acids is dependent upon what's growing in the gastrointestinal tract. And what you can see happen is a feed-forward cycle where now we're producing more toxins by those microorganisms in the lining of the gut that circulates through. It's called enterohepatic recirculation. It means that everything that's in the gut, our bodies are used to living in lack, right? We are designed to live with a lack of nutrients. That's typically historically where we were at as a species. So our body reabsorbs everything it can, right? So as stools moving through the gastrointestinal tract, those bile acids will be reabsorbed and then go back to the liver for processing again. And if you have dysbiosis, it's another source where they're taking those bile acids and making them more inflammatory, more toxic, and then our liver has to manage them again and again. And it's another reason why practitioners learn like detoxification 101, you never put someone on a detoxification if they're not having regular bowel movements. And this is why, because if you're promoting release of toxins from the liver and the gallbladder into the small intestine, then you're going to end up with an increase in toxic load in the stool. And if you're not regularly excreting, then you can end up getting a spike in toxic load in the bloodstream. There are a number of different ways you can support people on detoxification to help prevent any kind of side effect from that. One of those is a binding agent. The one that's made by Biocidin or Biobotanical Research is called GI Detox. And it basically is like a sponge that soaks up all of the toxicity that's been produced. That's not an FDA approved statement. And it's not a claim. It's just I'm just talking about the mechanism of action, right? So when it's activated charcoal, apopectin, zeolite clay, and it's a formula that helps to soak up those all of those toxins in the lining of the in the gastrointestinal tract, so that they're not reabsorbed, right? It's a way of preventing that enterohepatic recirculation. So it's called the gut-liver axis. It's a relationship between the liver, the gallbladder, and the gastrointestinal tract, and what's growing in the gastrointestinal tract. And yet another reason to establish health in the microbiome, or what's growing in the gastrointestinal tract. So just a quick review. Here are sources of toxicity from microbial imbalances. We have LPS, or lipopolysaccharide, and other metabolites, other inflammatory metabolites. We have damage to the liver cells. We have interruption of that gut-liver axis and causing increase in toxicity. And we have loss of protection from the beneficial microorganisms producing metabolites that will reduce the systemic levels of inflammation in the body. So just one other sort of pearl is that a lot of these microorganisms that cause chronic infection or chronically live in our body, if they've been there more than 2 weeks, they most likely, 80% of them will have a biofilm. It's called a biofilm. And I think about it like an invisibility cloak. So it's a matrix that they form. They basically pull over themselves. This is a simplification, oversimplifications, but they pull it over themselves when there are enough microorganisms around. And they pull it over themselves to hide. They hide from our immune system. They hide from antibiotics. They hide from any kind of adverse environmental condition, right? So if it's too hot, if it's too cold, if it's too windy, if it's too, all of the things, right? If a microorganism senses that they're in danger, they'll pull that biofilm over the top of them. And the reason that's pertinent for this conversation is because those biofilms are so sticky that they're actually used in hazardous waste sites to what's called adsorption. It's not absorption, it's adsorption, which means it holds on to and chemically binds to toxins, and it can be used in toxic waste sites to help with bioremediation. And so this is how toxic biofilms are. Now imagine that they're in your body, and we all have them. There are good biofilms, there are bad biofilms. But at the end of the day is the microbial biofilm. And chances are whatever toxins have kind of drifted past it during the day, some of that's going to be stuck in the biofilm. So if you miss this when you're working again with detoxification, then there's potential that you'll be missing a significant amount of ongoing toxic exposure inside the body. So just a little information about biofilms, and I'm going to go ahead and skip over that because I'm getting kind of long-winded here, but just an important piece to remember. And the other piece to remember about, or the other important aspect of biofilms and working with biofilms and microorganisms and balancing them, is that biofilms, because they bind toxins, from the outside world, our own toxins that we're producing on the inside world, because they're housing any number of different microorganisms. So we may think, oh, I'm going after a fungal biofilm, but the reality is underneath that biofilm, there could be microorganisms that your body is not currently aware of, it is not currently fighting a fight against. And so people can feel pretty rotten if you basically crack open a biofilm. They can get quite inflamed and quite uncomfortable from it. And this is why Biocidin is really considered a practitioner line of products, and we really like to provide good support to our practitioners. So I urge you to talk with your practitioner, speak with Bridget about how the best way to use this product for her, get some counseling from her. But this is why the binder was included. When you're working with anything that's going to reduce the load of pathogens and to help to balance what's growing in the gut, then you want to make sure and bring in the additional support of binding agents and to support that what's called die-off or Herxheimer, or it used to be called a healing crisis, which I came out sort of indoctrinated that healing crisis is a good sign. And since then, I've really come to believe that if you don't feel good when you're doing a therapeutic, it's because you're not adequately supported and you're actually causing damage to your tissue. Sometimes it's really, not really that big of a deal. Like maybe you get a headache for half a day, but if you are a person who is dealing with autoimmune conditions, or you have chronic fatigue syndrome, or you have something significant, Lyme disease or mold, then you really want to be careful and work alongside a practitioner when you're working with these products, because you really could cause sort of a flare in how your immune system is behaving. So just a really important piece of awareness as you're moving forward. So again, all of these sources talk from biofilms, and we just went through all of them, but just remember that biofilms may be playing a role as well. Here's a picture of a toothbrush bristle with a biofilm on it, and the same bristle at higher magnification. So you can see the importance of managing biofilms. When we think about the mouth, right, and the oral biofilms, you have dysbiosis, oral dysbiosis, meaning that you have an unbalanced growth of the microorganisms in your mouth. Then you may have pathogenic, or pathogenic means disease-causing microorganisms in these biofilms, and so it's another important place to be aware of. If you skip the mouth, let me go to the next slide and talk a little bit about it. If you skip the mouth, we have this is mycobiome, right? So we have 7 to the 10th microorganisms in a milliliter of saliva. So that's whatever 10 zeros after 7 would be, like many billions, trillions of microorganisms in a milliliter of saliva. And we swallow a liter of saliva in a day. So kind of gross, but it plays an important role, right? So it also means that what you swallow, some of it's going to get to your gastrointestinal tract. And we know this, there's actually research showing that people who brush their teeth after every meal have less yeast growing in their gut. And so that's, again, Candida albicans is what they were looking at in that study. They have less in their stool or in their poop. They have less yeast than someone who doesn't brush as often, which is basically proof positive that what grows in your mouth translocates, meaning it will move from your mouth to your gastrointestinal tract, to your gut, where it sets up housekeeping, and it can cause problems there. So again, really important. We don't want to miss the mouth. We don't want to miss the biofilms. We want to work with establishing balance in the gastrointestinal tract. So all of these things are very important to get full and complete effect of balancing the microbiome. And how frequent is this? 77% of American adults over 65 years of age have periodontitis. And if you include gingivitis, this age goes down to 35, which means that most of the adults in this country have an issue with oral dysbiosis. This is really important in today's world because what's growing in the mouth influences the microbiome in all sorts of areas of the body, including the sinuses, including the lungs, including, of course, the gastrointestinal tract. What's growing in the mouth can colonize the skin as well. And so it really is important to pay attention to all of this. And I'm going to skip this slide and move ahead. Actually, I'll say one thing here, which is that what you're seeing here is this is a biofilm, and biofilm, again, is that invisibility cloak around microorganisms. Our immune system comes in, it's trying to manage the microorganisms that are inside of the biofilm, and instead what happens is, again, that collateral damage. So they're firing away inflammation at the biofilm. It doesn't break down the biofilm, but instead you get this chronic inflammatory condition. The bloodstream is so close here that what happens then is those same metabolites, lipopolysaccharides and other inflammatory metabolites, cross then from the periodontal pocket here into the bloodstream. Not only that, but the actual movement of bacteria from the periodontal pocket into the bloodstream. And we now know that things like Porphyromonas gingivalis, so there are microorganisms that are related directly to Alzheimer's disease, to cardiovascular disease. And we've actually been able to see biofilms and plaque from these microorganisms on the in the infected, or in the plaque of infected, excuse me, I'm saying this wrong, let me try again. So microorganisms from the mouth and from the gut can show up in the lining of the blood vessels, where they are causing an inflammatory response that leads to cardiovascular disease. So again, another really important role here. And you guys are getting way more information than I probably should be giving you, but I find it also fascinating, and I want everyone to have this information. So keep your mouths clean is kind of the takeaway here, right? So this is research that was done by Dr. Rothschild, John Rothschild. He's a dentist. And what you're going to see here, I'll come back to this, or I'll just explain it here, but this is a picture, this is microscopy, so that he's looking under a microscope. All of this is a biofilm, and then you can see the microorganisms here as well. And so this is before, and this is after using a biocidal herbal combination, meaning that it's a botanical formula, and it's designed to help to manage the growth of the microorganisms in wherever you get it, right? So whether you're putting it in the mouth, whether you're putting it on the skin, whether you're swallowing it into the gastrointestinal tract, the purpose is to help to reestablish a healthy balance of microorganisms in the gastrointestinal tract. And here you see before and after. And what he said, his research outcome, right? So this is a pilot research, it's not published research. The liposomal botanicals used in our study appear to be a wonderful adjunct in the treatment of periodontal disease. The statement is based on actual controlled pilot studies that I performed clinically in my office. The periodontal study was utilizing classic clinical periodontal parameters and phase contrast microscopy. And I've spoken with him in person, and he was quite impressed. The other thing he said was the reduction in the depth of the periodontal pockets. And we will we're working on research right now that I would expect to start in about 6 months or so. Don't hold me to that. Everything takes longer than you think it's going to, I think in general, but at any rate, we're looking to reproduce this research, and this research is actually what initiated the production of our dental line of products, and we're going to talk about that shortly. This is also pilot research that was done by Claudia Marcus at the University of Binghamton in 2013. And these are two different microorganisms that are really notorious for the production of biofilms. What you can see here is a graph, in this graph this is a control here, meaning that they didn't have exposure to any antimicrobials or any antibiotics. Like they just were left to live. And this is an exposure to what's called planktonic, which means it's a free-floating cell. It's out there. It's not underneath a biofilm. It's just unprotected. And you can see one of those is free-floating. The other is a biofilm community. And here is after exposure, the drop in viable cells after exposure to biocidin. And so biocidin is a combination of 17 herbs, and in a glyceride tincture. It tastes like sweet pizza. So it's easy for kids to take it. It's one of my favorite things about the product. I love it with pediatric patients. And just to watch the turnaround for this product, and with gastrointestinal conditions, and then there's some other conditions that I routinely use this product to work with as well. This is also biofilm research by the same woman, Dr. Marcus, and you can see here, this is a biofilm candida, so a fungal biofilm, and total dismantling of that biofilm within 1 hour, and the inability for it to reestablish itself within 24 hours. One of my favorite things about working for Biocidin is that they have this ongoing commitment to research. So we have 2 different published research papers, one that's a human clinical trial and one that's what's called in vitro research, which means it was done in a petri dish, and that was done on Borrelia, which is the organism that causes Lyme disease. But right now we're working on research that will be a publishable research with Dr. Raja Sivamani of Pacific Skin Institute, and we're evaluating rosacea and SIBO. So what it means is that the people involved in the study have to have not just SIBO, so that small intestinal bacterial overgrowth, but also rosacea. Then once that happens, we're evaluating a whole slew of markers, and we're going to be out with that research in the next year or a year and a half. It just takes time to get the people through and to evaluate the data and all of that. But really exciting research coming forward for the company in this way. The other piece that's really interesting, and I think what we get asked the most often is, okay, so if Biocidin works to balance the microbiome, what does it do to the beneficial microorganisms? And what, in doing our due diligence as a company, we looked at that. This is again pilot research through a company called Sun Genomics, and that they do something called full genome sequencing. And so they're looking for microorganisms that are in the stool of the gastrointestinal tract. Each one of these colors is a different patient that you can see here. And these are all beneficial microorganisms, the ones that we consider very important to evaluate in the industry. And then you can see total abundance here, right? So before and after, and this is before, and then they would do a stool test before, take Biocidin liquid, so our flagship product, and the GI detox together for 8 weeks, and then reevaluate. And what we were able to show here is that there was actually an increase in the beneficial microorganisms and some of these very, very important beneficial microorganisms in the stool when using the Biocidin liquid along with the GI detox. So really exciting research for us. So a Biocidin, potent broad spectrum, supports clearance of multiple classes of harmful organisms. Again, this is just, I hesitate to even talk about this because this isn't FDA approved research. This is not a claim by the company. Many of the ingredients that are in this have lots of research to back them up. And we do have some of that pilot research. And we do have some published research to support these bullet points. But we think about the ability to balance the microorganisms. We think about biofilm components, think about immunomodulation, which means it affects our immune system function. And we think about its ability to modulate inflammation. And so we actually, the human clinical trial that we have shows an increase in immune function within 1 hour. So 66% in immune response in the mouth when using the Biocidin throat spray. So and pertinent for the world right now. So Biocidin testing, Biocidin was on 250,000 stool samples. It was the most sensitive subject for microorganisms. So really, that's a huge quantity of data. So this is the GI detox, which I talked about briefly. And this again is the binder. Cleanses and supports the microbial balance, or recommended for use alongside the Biocidin, because as microorganisms are shifting and dying off and finding balance in gastrointestinal tract, then using this GI detox to help support the microbiome, or to help support a reduction in toxic load while you're doing that, can really bring a lot more comfort to the process. GI detox binds more than just microbial die-off or Herxheimer reactions. It also, we know that activated charcoal is used acutely to make heavy metal for people with heavy metal poisoning. All of these, zeolite is getting really renowned, as well as a broad spectrum binder. So really, really useful for, for die-off, but I think of it in general for detoxification support. It is really important to understand too that when you take GI detox, it will absorb anything you take it near. That means it needs to be at least an hour, ideally 2 hours away from other food, and especially medications, which will absorb and render inactive as well. This is our toothpaste. So this has Biocidin in it, and it's also a natural toothpaste base to help address microbial balance and biofilms in the mouth. So a really nice product. We're all already brushing our teeth. This is an easy place for us to start to get that toothpaste into our mouths, our kids' mouths, to help to start to establish balance in the oral, and then because of that, the systemic microbiome as well. If you're looking for something with deeper activity, then liposomal Biocidin would be the one you're after. So a liposome is a chemical form that gets better tissue penetration. So if you're trying to get down into the periodontal pocket, if you're trying to get deeper into the tissue, directly into systemic blood flow and lymphatics, then the liposomal form is what you'd be after. And that's what the oral rinse was established for, is to get that deeper activity. In addition to the liposomal, Biocidin, this also has other nutrients to help with breath, to help with healing the mucosa in the mouth. And we've just gotten excellent feedback from practitioners, including biologic dentists and hygienists, on the use of this product, and watching patients turn around that have had some difficulty with their oral health. So I want to thank you so much for joining us. Thank you, Bridget, for having us on the show. If you have questions, please direct them to Bridget, and she'll answer them for you. And we're so happy to be here, and I hope you give the product a shot and that you see the same outcome that I watched happen for myself and for my patients. Take care and have a great day.
Well, that was kind of fun, different way to do things, but that worked out just fine. I saw her speak at a conference, I guess this last spring. She's so phenomenal. So I'm so glad you got to experience her research and her presentation. You know, it is kind of high level, but even if you pick up a few things from it, and she kind of gave a nice explanation of some of the products at the end there. If you have any questions about the products, I'm happy to answer them. Yeah, you're welcome, Maria. It's a really good one, and I love learning more about the mouth. This company is really focused on oral care, and you don't find a lot of that. So we use the toothpaste all the time. I kind of forget to use my mouthwash, but when I do, I feel amazing. So I have a water pick now. I have the mouthwash. I have a tongue scraper. I don't always brush teeth after meals, and I really would like to start doing that too, because you feel just like amazing when you get that film off your teeth. So they've also had some really great results with Lyme infections in the mouth and gum disease and stuff like that. Yeah, you only need a little bit of the toothpaste and the mouthwash. You know, they're kind of expensive compared to a normal toothpaste because of all the ingredients in them, but they do last a while. I feel like I'm barely ever buying a new bottle. Yeah, Maria's saying she's going to start brushing after meals. It really does feel amazing, and it keeps you from snacking as another benefit, because it's like your mouth is all clean. So you just kind of want to drink water after that. So I had a question about the GI map and what it tests for. I don't believe it tests for LPS directly. I'm sure you can get that test run, but I don't think it's on there. So give me a minute and I'll pull up an example test results. But there's a lot on there that does apply because it tests for bacteria, and if those are, sorry, one sec, if those are like too high. So a lot of what Biocidin tincture does, which we do sell on the site, is reduce those loads. So I think that study she said was for 8 weeks. That means 8 weeks is a long time, right? Being consistent. Sometimes we give it even longer than that. It's strong. It does create some die-off reaction, infections it can see. And yes, we don't do transcripts of these, but we do put them on YouTube, where we can get some auto-generated captions, I think. So let me talk to my team about that. It's a long one, so I don't know how accurate all the captions would be, but let me show you an example test of GI map. Let's see. Sample report. So on this page, one of the tests, these are kind of like acute infections, and usually this page is blank, but not 100% of the time. We do see sometimes infections be live here, and I feel it's the microbiome or the immune system is not able to deal with them, so they're lingering. This page tests for H. pylori. Just reading something about H. pylori today. It can also, I think, damage the liver from its endotoxins that it produces. So if we see anything out of range here, we always treat it. Sometimes these virulence factors are present, but often they're not, and those means it can be more leading to stomach cancers. And this section is about normal flora. So for instance, this person has a couple of flora that are low, so it's something we could work with the biocidin, with the mega-pre, the mega-spore biotic, bringing those populations up. Whether or not the beneficials can be high is a little bit debatable, but sometimes with like blood sugar issues, I think they say that's causing some of them to be high. And then here is like overall populations. So just seeing if the person has enough quantity of beneficial bacteria, and this person did not. And then this section is really pertinent to what we were just talking about and learning about, which is dysbiotic or opportunistic bacteria. So these bacteria could be producing some of that LPS she talked about that is toxic. And this person had 3 of them high. That's pretty typical to see on a test result with us. So this is kind of where we go in and do some killing while we work on rebuilding. This section is more pathogenic or opportunistic bacteria, especially that are linked potentially to autoimmunity. I personally don't see necessarily like a one-to-one, how can I say, correlation. But when I see something here, it's just another thing we want to reduce. It's another overgrowth. So there's mold in the body, or there's too much sugar in the body, or maybe the motility is too slow, or that recirculation is toxic like she talked about. So we want to reduce all this pathogenic LPS producing activity. This is for fungus and yeast, which again is often negative because it's not the best way to test fungus and yeast through the stool, but it can be positive. A better way to test is through the urine with our Envirotox test. Viruses occasionally could come up on here, but they're not always going to show. It would have to be really active in the stool to show up there. Parasites and worms, I would say maybe 20-25% of the time we see one of these common parasites or worms detected. And then this section is markers of health. So we have steatocrit would be fat in the stool, elastase. I think that's just like it's just in like an enzyme, so you want it like high enough to show there is enzyme activity. This person had this beta-glucuronidase elevated, so that's not a good thing. It's an enzyme that's going to break bonds that were moving toxins out of the body. It's going to break it so those toxins can recirculate. And this number generally goes high when the microbiome is off. Blood in the stool, secretory IgA is how much of that healthy mucosal lining do you have. So that's a really important barrier between what's coming through the intestines and your bloodstream. You want that to be nice and thick. It is 90% of the time low in everyone we see. So this is a really important thing to build back up. We do that with mega IgG, mega mucosa, and then just working on everything else, because that lining can get thin with the presence of infection, the lack of good bacteria. Here's the anti-gliadin is one marker of gluten sensitivity. Calprotectin, I never really see that elevated, to be honest. This is an additional fee. The zonulin is a marker of something that can open up the lining and create leaky gut. So it's usually a marker I think is worth adding on. So this can let the LPS through. So we're not testing LPS directly, but we can see some of its sources, see potentially here, yes, the microbiome is off, toxins are being recirculated, and here was like the gut is leaky, toxins can get through, including LPS, and stress the liver. So it's a great test. This just is a short section on antibiotics and how they would interact with your type of H. pylori. Which bacteria produce LPS? I think there's a lot of sources, and some of them are not always bacteria, but I don't have a list of that. I would like to get you one though. The woman's name is Jocelyn Strand, and I don't know if she has a page up on the Biocidin page or not, but that's a company she's working for and who she gave this presentation for. So it's a company that we've had a relationship with a long time, really kind of since I started as an online coach in the functional space. So they're a really great company, been around a long time, a lot of integrity, and like she said, they're doing the testing. So right now, 10% off everything we sell of theirs. So we sell the toothpaste, the mouthwash, the tincture, the throat spray, and the binder. I think that's all we sell. So they're all really great products. Free shipping at $97. And then the GI map I just explained is $50 off. It always comes with a consultation with us, so you're not like guessing. So we'll talk you through the results, make you a protocol, you know, consider everything else going on in your case. It can be a great addition if you're dealing with mold, because mold really allows pathogens to be able to grow because the immune system is weakened, the gut becomes leaky. So it's pretty rare you're going to have mold and not have gut issues. Yeah, the binder is really nice. It's really well tolerated. It's pretty affordable. So great. Our test for mold, we use a company called Great Plains, and it's on our testing page. So that's at hormonedetoxshop.com. We have a sale on that coming out in August, I think. So you can keep an eye out for that little sale. Yeah, it's a great test, and I should go over that too and give, you know, maybe I will come on in August and do a presentation on that one. But I've done some before too, so I could kind of recycle them. But it's a really fantastic test. It tests Candida well as well. Yes, it's a mycotoxin urine test. I feel like there was something that I was going to do. Oh, yes. So that sale code is BIO2021. I think it's good through next Thursday, or at least Wednesday. But I would say if you want to use it, go sooner than later in case, you know, you forget. Or if you just want to try the toothpaste or the mouthwash, try something you haven't tried before, go ahead. Even if you don't totally have, you know, a clear protocol, the binders are nice to have on hand if, you know, you just want to support some daily detox, if you're using your sauna, if you have, like, you overate or you got food poisoning or you have a hangover. So it's good for a lot of things. It's a nice thing to have around. And you can find all that at the shop right here. So thank you, everyone. I will not be here next week, but maybe we will book a couple things in August about the mold test and some other things. I'm just working diligently on my book and trying to stay kind of focused, plus it's summer, so just sort of more traveling and more things going on. So you guys are probably traveling and kind of busier too. Thank you, Maria. I really appreciate you guys. I actually really enjoy these little weekly times. But occasionally I'm like, maybe I need a little break. But we always come back. Thanks to everyone. Appreciate you being here. And this will be up on YouTube probably by tomorrow if you want to share it with a friend, and we probably put it out in the newsletter as well. Thank you, Barbara. Yeah, I'm doing a little better. I think I'm kind of developing some little allergies with like a post-nasal drip, but I definitely sounded better this week than last week, right? Last week I was kind of a mess. All right, appreciate you guys. Have a great weekend, and I will see you soon. Bye.